Hi, my name is Sadie. I'm a nurse here at Same Day at Passivant. Can you tell me your name and date of birth?
Rachel Kilburn, 12/22/94.
And can you tell me where you're at and the date today?
Passivant Area Hospital, 9/18/18.
And what are you here for?
Just a physical checkup.
Okay. There I was checking to make sure the orientation of the patient and the level of consciousness, making sure that she knew where she was and the correct information was given. I'm also noting overall dress and hygiene, and I'm also going to be watching the external eye movements during this assessment. When I first start out, we're going to be assessing skin. I'm going to be noticing overall skin color. It should be consistent with the genetic background with the patient. There should be no abnormal colors. If we're looking for the 4 abnormal ones: paler, erythema, cyanosis, and jaundice. Next, we're going to be assessing skin texture as well. We're going to be noticing that it's smooth overall with a firm texture. Next, we'll be doing skin temperature. We'll be doing this on the upper and lower extremities, using the back of my hands, feeling the patient bilateral. Sorry, I didn't do that. Upper and lower extremities. Warm consistency overall. Warm temperature equals it's a normal consistency for the patient. Next, I'm going to be doing mobility and turgor. I'll be pinching a large inch under the clavicle and releasing it. Mobility is the ease of the skin to rise. Turgor is its ability to be released back to place promptly. This is testing the elasticity of the skin. Decreased mobility could be seen with edema, and poor skin turgor could be seen with severe dehydration. Next, we'll be looking at the lesions on the body. If I do see any lesions, I'll be putting gloves on if they're coming in contact with mucus, blood, or body fluids. We will be pressing the lesions, noticing any blanching or stretching. We'll be also using ABCDE with its asymmetry, border, color, diameter, and elevation. Next, we'll be assessing nails, upper and lower extremities bilaterally. Nails should be curved and smoothed. There should be no brittle or clubbing noted. We'll be also assessing capillary refill, which is pressing down on the nail. And releasing color should return in less than 2 seconds. This is testing peripheral circulation. Next, we'll be assessing the scalp and the hair. I'll be putting my hands on the patient, noting an overall distribution of hair. There should be no patches, lesions, or pests noticed. Hair is from fine to thick, like I said, an overall distribution. While I'm at the hair, I'll be assessing the scalp and the skull. It should be firm, smooth. Term for a normal head is normocephalic. Microcephalic is abnormally small. Microcephalic is abnormally small. Macrocephalic is abnormally large. There should also be no protrusions or obstructions noticed in the skull. Next, we'll be doing facial features. Facial features should all be symmetrical with the eye movement. Eyebrows should be move symmetrically and be on the face symmetrically with the face. Next, we'll be doing the external eye movement. As I've been doing this assessment, I've been watching sure the patient hasn't been having a wandering eye, wincing, squinting, and that they've had normal movement while they've watched me walk around. We'll also be doing assessing the conjunctiva and sclera, having the patient remove their glasses. I will be using my thumbs, having the patient look up. I'm going to be looking at the conjunctiva, making sure that it is moist, clear, and pink. The sclera should be white. At this time, we'll be assessing PERLA, which is pupils equal round react to light and accommodation using my pen light. Going in from side to side, having the patient look straight ahead, and we're making sure that the pupils constrict on each side bilaterally. And we can note the size of the pupils on my pen. Next, we'll be doing the 6 cardinal signs, having the patient look straight ahead as they follow my finger in 6 different ways, which is the cardinal signs. And these are all assessing cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens. Next, we are moving on to the nose. We're looking at the nose to make sure it's midline with the face and the facial features, noticing any lesions or obstruction to the nose. We also have to be having the patient tip their head back as I look in their nostril to make sure they don't have a deviated septum notice. We'll be then doing the smell test, nasal patency, which is cranial nerve 2 olfactory. Have the patient close their nostril and close their eyes as they sniff and tell me what they smell.
Peppermint.
And doing the same on the other side. And then I'll be next having the patient, or palpating the frontal and the maxillary sinuses using my thumbs across the forehead and across the cheeks, noticing any tenderness, which could be signs of an acute infection or allergies. I'm next going to have the patient stand up as we do the confrontation test. This is testing the peripheral vision of the patient. I'll have them hold a card over their eye as I hold it over the same one, and I will be asking the patient when they can see my eye or finger, telling me now.
No.
And we'll be doing this from 6 different ways.
No. No.
And then we'll be also doing the same on the other side. And I'll be comparing it to my eyes, if mine is actually normal. Next, I'm going to be assessing the temporal arteries and the temporal mandibular joint. The temporal arteries should be normal bilaterally, and then having the patient open their jaw. Feeling for any tenderness, limited range of motion, or any clicking, which could be signs of TMJ. Next, I'm going to be assessing the mouth. On the outside lips, it should be moist, pink. There should be no cracking or lesions on the outside of the nose. I'll be retracting the bottom lip, noticing the inside of the gums. They should be a pink to coral stippled surface. I'll be noticing any debris in the teeth. Making sure there's no debris in the teeth and that the number of teeth is normal for the age of the patient. I'll be next using my pen light and my tongue blade as I assess the tongue and the inside of the mouth and the throat, having the patient open their mouth. Tongue should be pink, it should not be beefy red, and it should be smooth. We'll be looking at the back of the throat and the uvula, asking the patient to say ah. Uvula should rise midline, and also looking at the tonsils, they should be pink with no exudate. Tongue should also not be deviated to one side. This is assessing cranial, or I'll also assess the gag reflex as well. Pushing the tongue blade back and making sure that the patient has a gag reflex. This is testing cranial nerves 9 and 11, glossopharyngeal and vagus. We'll also be noticing the nasolabial folds on the patient, which is from the nose to the mouth, which is the folds to the nose to the mouth, and they should be symmetrical bilaterally. We'll also be assessing the palpable fissures of the eye, and that's just the upper eyelid. Next, we'll be moving on to the ears. The ears should be, the overall color should be consistent with the facial features. I'll be pulling the peanut up and pressing on the tragus. The tragus should be firm with no tenderness or pain noted. We'll be then doing the hearing whisper test, which is assessing cranial nerve 8 acoustic, having the patient cover an ear as I whisper 3 words, 5-6B, and having them repeat,
5-6B,
and doing the other side, 5-6B.
5-6B.
I will be assessing the trachea midline, or palpating the trachea midline, making sure that's not deviated to one side. We'll be palpating the thyroid lobes, and then making sure that if they shouldn't be palpable. If they are, they should be a rubbery, round feeling. Next, we'll be doing the 10 lymph nodes, starting with the preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. We're also going to be assessing the lobes on the back of the patient. Going back here again, having the patient sit up straight as I assess the left and right thyroid lobes, having the patient tilt their head to the left as they swallow, and I will be feeling for it, and then doing the same on the other side. I'm also going to be assessing the carotid arteries, both on each side, making sure that it is a firm pulse noted. I'll be going to the front of the patient and be assessing for a carotid brewery, having the patient turn their head to the side, and if they hold it and take a deep breath and hold it as I assess their carotid for any swishing or blowing noises, which could be a sign of a carotid brewery. Next, we will go over the health history and illness assessment using cold spa, which is character, onset, location, duration, severity, pattern, and associated factors. So we will go through that using the cold spa and trying to figure out the illness that they have. Next, I'm going to do a health education for the patient. She is outside a lot in the sun, so I'm going to be making sure that she uses the correct SPF on her body. We'll also be going over the ABCDE lesion assessment, which is asymmetry, border, color, diameter greater than 6, and then elevation, and showing her how to do a self-body exam in the mirror at least monthly. If she does find any lesions, she needs to see her primary care doctor as soon as possible.